The second part of experiment 1 is about factors affecting drug effects. Actually, it includes 3 small experiments. They are effect of drug dosage form on drug effects, effect of drug physical-chemical property on drug effects, and effects of administration route on drug effects. Before experiment, let's review the factors affecting drug effects. Actually, they are broadly divided into individual factors from body and drug factors. These factors can cause individual variation, including pharmacokinetic variation and pharmacodynamic variation. I think you know, even the same dose of the same drug by same administration route for different individuals, maybe they will show different pharmacological effects. This individual variation caused by individual factors, like gender, especially age, body weight, even many diseases. And you know, some other conditions, even for the same individual, we administered a drug, same drug, but in different dose, they also induce different pharmacological effects. It's very easy to understand. And here, you should know well about the drug factors. It mainly includes physical-chemical properties of drug. I think you still remember maybe, like lipid solubility, water solubility, pKa of the drug. These properties will affect the process of drug transmembrane transport. So they will affect the absorption, distribution, metabolism, and excretion of the drug in the body. So they will alter the drug concentration in plasma. So finally, it will exhibit the different pharmacological effects. Dosage form and rules of administration. The pharmacological effect caused by the drug, it is always determined by the dose of a drug in the body. And dosage form, sometimes it can determine the rules of administration. Like solutions can be administered intravenously, intramuscular, or subcutaneous injection. But pills can be administered orally, even for the same rules of administration. There are also some different dosage forms, like pills, capsule, powder, solutions. Even for the same rules of administration, like oral administration maybe, they also induce different effect caused by different dose forms. Sometimes maybe some patients require drugs used in combination. So it also brings out drug interaction. The result of drug interaction includes synergism and antagonism. And this drug interaction also include pharmacodynamic interaction. For example, if someone is suffering from a serious bacterial infection, and the exact bacteria, it is not clear. So maybe this patient requires several different antibacterials, antibiotics, use them in combination. Maybe they have different antibiotic spectrum. The different antibiotic drugs also have different antibiotic mechanism. So sometimes it is necessary. So they maybe have synergism. Pharmacokinetic interaction. It usually caused by affecting absorption, distribution, metabolism, and excretion in the body. For example, these two drugs, they have the same way for their excretion from the body. So when they use in combination, they will compete to be excreted from the renal tubule. Look at the experimental materials. The animals for the 3 experiments are mouse. Watch this video. The experimental instruments and drugs: picric acid, pentobarbital solutions and mucilage, barium sulfate and barium chloride solutions, and nicosamide solutions, cotton swab, nippers, and injectors for different drug. Mouse cage, balance. First prepare the balance. Turn on and adjust the balance to the 0. First one is the effects of drug's dosage form on drug effects. The objective of this experiment is to observe the differences in the effects of pentobarbital sodium in different dosage forms to understand the effect of dosage forms on the effects of pentobarbital. This pentobarbital, the dilution of this pentobarbital sodium is same. Both of them are 0.5%. But just one is a solution. Another one is mucilage. This mucilage contains carboxymethyl cellulose sodium, which makes the drug like gum. This is mucilage. Solution and mucilage, they are the pentobarbital sodium in different dosage forms. This drug is pentobarbital. Actually, it is one preparation of barbiturates. You have studied benzodiazepines when you studied the chapter of sodium, the chapter of sedatives and hypnotics. Do you still remember them? Yeah, in that chapter, you mainly study benzodiazepines. They are more important than barbiturates. But actually, I also introduced the barbiturates. Similar to benzodiazepines, with the dose increase, barbiturates also have dose-dependent pharmacological effects. When they are used in relatively low dose, their pharmacological effects is sedation and hypnosis. So based on this effect, barbiturates can be used to treat some sleep disorders. But till now, because of benzodiazepines are relatively safer than barbiturates, and benzodiazepines also has less dependence on the tolerance than barbiturates. So that's why barbiturates for sedation and hypnosis nowadays they are replaced by benzodiazepines. So that's why in that chapter, benzodiazepines are more important than barbiturates. And especially benzodiazepines, when they used in very, very low dose, less than the dose to cause sedation and hypnosis. Benzodiazepines also have anxiolytic effect. Do you still remember? So in the treatment of anxiety, we can choose benzodiazepines. This is a big difference from barbiturates. As the dose increases, barbiturates also have anticonvulsant and anti-epileptic effects. So this effect, till now, it also is very useful in the treatment of some epilepsy seizures. They are useful. Like phenobarbital can be used to treat tonic-clonic seizures and status epilepticus. But they are not the first choice. Do you still remember in the treatment of status epilepticus, which one is the benzodiazepine? Which one benzodiazepines is the first choice? Yeah, diazepam, intravenous injection of diazepam. As the dose further increases, barbiturates also can cause anesthesia. Like this preparation, salpental. This drug, till now, it also used in induced anesthesia, in general anesthesia, because it has very fast sedation. And, this is inhibitory effect on the CNS of barbiturates. Like phenobarbital, this drug is also used for pre-anesthesia medication because of its sedation. Today, in your experiment, you will use pentobarbital. This preparation actually for humans, it is not used. But for animals, especially in experiment, this preparation is commonly used for anesthesia in animal experiments. And after administration of pentobarbital, if the dose is large enough, it often causes anesthesia. When the animal are in anesthesia, they will lose some reflex. Now, look at this. In this experiment, you mainly observe this reflex. Before administering pentobarbital, you should first observe normalizing reflex of mouse. And after administration, you also should observe when the normalizing reflex disappears. Now, first, know what is the normalizing reflex. Mouse is a kind of animal with 4 limbs. So in the normal conditions, their normal posture is standing on the ground with their 4 limbs downward. So when you control them like this position, let them 4 limbs upward. Once you lose your hand, these mice are left from your control. They will recover their body normal posture. Now look at, this is normalizing reflex. Wow, very fast. See it again. Watch it again. Oh, sorry. It's so fast. But when pentobarbital or others anesthetics, when they take on-site their pharmacological effects to induce anesthesia, the animal will lose this ability, lose their normal reflex. Like this one. If you let them full limbs upward, it just is grazing on the ground and lose this ability. Once the drug take onset its pharmacological effects to induce anesthesia, this mouse lose ability to recover its body normal posture. So this normalizing reflex disappears. Experimental procedure. For this experiment, you need 2 mice. Take 2 mice and first observe normalizing reflex, and then weigh their body weight and record their body weight on the paper and mark them by applying picric acid. For example, you can make a yellow point here. This is number 1. And you can apply 1 yellow point here. This is number 2. For number 1 and number 2, they should be administered different dosage form of pentobarbital. Now, the administration rules, both of them are be administered by intragastric administration at the same dose, 0.1 milliliter per 10 gram body weight. Notice, to administer drug to the mouse, usually the volume of the drug should be calculated according to its body weight in per 10 gram. So for the number 1, you should administer pentobarbital sodium mucilage. And number 2, you can administer drug pentobarbital solution. Both of them administered by intragastric administration. Notice the needle of these injectors for the intragastric administration with its body weight. For this mouse, its body weight is 25.7 gram. In order to calculate the volume, the required volume for this mouse, you can record the rounding value of its body weight. So it's 26. This is 24 gram. Mark it. This is number 2. Number 1, number 2. Mark them at different area of the bike. Calculate how much is the volume of the drug according to 0.1 milliliter per 10 gram, and then take drug. This injector is for mucilage. During your experiment, it is not necessary to do according aseptic operation. So you can take off the needle from the injector, but when you adjust the volume of the drug injector, you should wear this needle now till the tip of the needles flow out the drug. This injector is for pentobarbital in solution. You know, in the clinical practice, aseptic operation, it is essential, so don't take off the needles from the injector. The volume of the drug is very important, so you should adjust the volume. To eject the air bubble by knocking the injector with your finger. Administration route is intragastric administration. When you inject the drug to the mouth, you should make the body of the mouth upward. Don't forget, before administration, observe the normalizing reflex. You know, these conditions, it still has its consciousness. Now, after several minutes, its normalizing reflex disappears. And then observe carefully. Observe their normalizing reflex. When the mice lose normalizing reflex, and record the time and observe how long this effect is the effect duration. The results of this experiment we did is like this. For example, remember, for number 1 mouse, we administered the drug of pentobarbital sodium in mucilage. The dosage form is mucilage. The latent period to take onset of its pharmacological effects to lose normalizing reflex, the required time is 7 minutes 10 seconds. So this is the latent period for number 1. And this effect lasts for about 38 minutes 30 seconds. This is the duration of its action caused by mucilage on number 2 mouse. Mouse number 2. This is for number 1. For the mouse number 2, the latent period is about 4 minutes 35 seconds. And the duration of this action is about 25 minutes 5 seconds. Please compare. You know, Mouse number 2 is administered the drug in solution. So actually here they have different latent periods and different drug action duration. Why? So when you finish your experiment, please discuss. Can you explain these results? Here, I show you this curve. Do you still remember this curve? You know, the effects like this effect is normalizing reflex disappear. You know, it means the mice are in anesthesia. So this is the effect of the drug. It always determined by the drug concentration in plasma in the body. You know, after administration, this is oral administration, similar to our oral administration for humans. You know, this is intragastric administration. So drug requires a period to be absorbed to reach this minimum effective concentration. So before this, because the drug concentration in plasma is not high enough to induce pharmacological effects, so this period is latent period. Once the drug concentration in body is exceeded than this level, it will show effects like I see here today. And then the drug will be eliminated, you know, after absorption and the distribution. At the same time, the drug also can be eliminated. So the drug concentration in plasma, it will decrease, further decrease, even lower than this minimum effective concentration. So since here, its effect will disappear. So finally, the mice will recover. Finally, the mice can recover their normal body posture. So recover is normalizing reflex. So during this period, the mice has no ability to recover its body normal posture. So they lose normalizing reflex. This is its action duration. So for the mouse number 1, this duration is relatively longer than number 2. And the latent period is longer than mouse 2. You know, for mouse 1, it is administered the drug in mucilage. Number 2 is administered the drug in solution. So this casts this difference. I think here maybe you are clear. Because the solutions of the because pentobarbital sodium in solutions can be absorbed relatively faster than the drug in mucilage. So the required time to reach this Cmax, the peak time, is relatively shorter than drug in mucilage. The drug in solution peak time is shorter than the drug in mucilage. And then, of course, its elimination also is relatively earlier than the drug in mucilage. That's why the latent for the number 2 mouse, it is relatively shorter than number 1 mouse. And the duration also is relatively shorter than number 2. You know, absorption caused by mucilage is relatively slower than caused by solution. And similarly, it also elimination of the drug in solution. It also is relatively faster than the drug in mucilage. Do you understand? It is relatively the elimination of the drug in mucilage. It also is later than that of drug in solution. So here, make a conclusion. The drug dosage forms have effects on drug effects because because they can affect the process of absorption. Next experiment is about the drug physicochemical property. Now, the animal also is mouse. The drug include barium sulfate because barium sulfate, it is insoluble in water, so this solution looks like entropic liquid. Another one is barium chloride solutions. Barium chloride solution, this is soluble in water. So after administration, the effective substance in this drug is barium ion. Barium ion. So after administration, these two different barium cells, and then observe the behaviors of the mice. Now look at the experimental procedure. Also take two mice, observe their behaviors, and weigh their body weight, and record the body weight on paper, and mark them as number 3 and number 4. For example, maybe this is number 3, this is number 4. Just applying picric acid at the different local area on the back of the mouse different from the other number. Now, administer drug. The rules of administration for both two mice all are administered peritoneal injection. In same dose, 0.1 milliliter per 10 gram. For number 3, you should administer barium chloride. Number 4, you can administer barium sulfate by peritoneal injection. And then observe carefully and record their behaviors. Note: because the barium sulfate is insoluble in water, it is necessary to dilute the container before using it. Now, please watch the video. This is the process of this experiment. Take two mice and observe their behaviors. Weigh their body weight. This one can be considered as 25 grams. Mark it. Apply this yellow solution at the right side of its body. This is number 3. This is 23 grams based on rounding value. Apply this yellow solution, picric acid, at the right side different from number 3. This is number 4. And calculate how much is the required volume of the drug. Number 3, 0.25 milliliter. 0.23 milliliter for number 4. Both administration routes are peritoneal injection. Prepare the drugs with the injector. This is barium chloride. For aseptic operation, don't take off the injectors, needles. Just now, especially for the mucilage during your experiment, for convenient operation, you can take off the needles from the injector. Use your finger to knock the injector, adjust the volume of the drug according to its body weight. This is most 3. Peritoneal injection at its lower abdominal part. Another mode should be administered barium sulfate, jeweled container. Barium sulfate injector. To make sure the drug in your injector to contain the barium sulfate by jolting container of the drug. After ejecting the air bubble, adjust the exact required dose. Hold the mouth with your left hand and inject the drug with your right hand. Peritoneal injection. After injection, put them in the mouth cage and observe their behaviors. Actually, the result of this experiment between these 2 mice is very obvious. The result is like this. For mouse number 3, at the beginning, maybe this mouse showed difficulty breathing, and then followed by muscle tension and weakness. Finally, it was died. But number 4, this mouse is administered barium sulfate. It's normal. It is like the before administration drug. The mouse number 4 has no change. This is the result. Why? Now, let's analyze. You know, barium chloride is soluble in water, but barium sulfate it is insoluble in water after peritoneal injection. The barium ion, it will induce some effect, like lead to final dyes. It is caused by barium ion. But you know, barium chloride and barium sulfate, they have different water solubility. After peritoneal injection, they have different absorption, you know. Because barium sulfate, it is insoluble in water. Do you still remember? You know, most drug transmembrane transport by simple diffusion. You know, this barium sulfate, it is not dissolved in water. So it has no ability to dissolve in the body liquid. Understand? Any body liquid. So it cannot be cannot transmembrane transport. You know, it cannot pass across the cell membrane. Cannot be absorbed exactly. But barium chloride, it is soluble in water. It can be absorbed and take its effect on site. It's very quickly. Actually, the result is caused by barium ions. Barium chloride, similar to the other barium salts, like barium nitrate. You know, they all are insoluble. They all are soluble in water. Once administered, they will induce some effect. They have inhibitory effect on the CNS and act on the heart. It can induce arrhythmias. So finally, this drug leads to dyes. So barium ion and the soluble compounds of barium, notably chloride, nitrates, hydroxide, they are toxic to humans. Although barium carbonate is relatively insoluble in water, it is still toxic to humans because it is soluble in the gastrointestinal tract. So, notice, don't intake these barium compounds. So, for this experiment, make a conclusion. You know, this is barium salt. Two preparations. They have different physical chemical property. They have different water solubility. So they have different pharmacological effect. Actually, they have different effect on the mouse. So the physical chemical property of the drug have effects on the drug effects.